All right. Welcome, everybody, to the April Board of Public Health meeting. I do want to welcome Sophia. Welcome. I know you're here observing, so welcome to you. We are going to hear from Brooke Simonin today, who's the clinical coordinator for the Regional HIV and STI Grant. Welcome, Brooke.
Hi, everyone. My name is Brooke Simonin, and I'm the clinical coordinator of the HIV and STI Grant. I'm going to go over the grants a little bit today. You know what we're doing. So our goal with the grants is to ensure that prevention, testing, and treatment is available throughout the 5-county region. The counties include Summit, Portage, Mahoning, Columbiana, and Trumbull counties. In 2019, the regions statewide were reorganized to align with the Ryan White regions, and SCPH began serving these 5 regions. This grant allows SCPH to provide HIV and STI counseling, testing, and referral for vulnerable populations in the region, and it's accomplished through strategic regional partnerships and ongoing coordination within the region to ensure up-to-date training, implementation, and reporting processes. So the 2 grants, they used to align, and they don't anymore. So the HIV grant started in June of last year, and it runs through the end of May of this year, and that's for $312,266. The STI grant runs from March of this year, and it goes to the end of February of next year, and that's for $344,095. So the HIV grant is 100% base grant, so that means 100% of that money is available to spend during that time period. The STI grant is 75% base and 25% deliverable. So for the STI grant, there are a few things we have to do every year. So we have to make sure that we're meeting performance measurements, including that we're interviewing people on time and needed. We have to conduct a marketing campaign, and we have to be represented at all mandatory events. So sometimes we do a Columbus or have meetings that we have to do that. The last thing is our testers here, they're called our DIS, do have to do some field syphilis and HIV testing. So the funding that we have is used for SCPH employees, subcontractors, advertising, medical supplies, mileage, lab fees, office supplies, and cell phones. And the employees that we have that are either fully or partially funded by these grants are the clinical coordinator, which is me. We have a clinical supervisor, public health nurse, a licensed independent social worker, the medical director, and the director of nursing. So since the grants don't line up completely, I'm just going to give you the numbers from 2025 in total. So in the region of the 5 counties, we did have 84 HIV cases, and in Summit County alone, there were 44 of those. So Summit County definitely has the majority of the cases. And then 293 syphilis in the whole region, with 192 in Summit County. And then there were 7 congenital syphilis, which was when syphilis passes from the mother to the baby. 6 of those were in Summit County. Syphilis cases have increased by nearly 80% in the U.S. between 2018 and 2022, but our region has seen a decrease of 33% in syphilis from 2023 to 2025. So we're really proud of that. And while the syphilis cases have been going down in our region, congenital syphilis has been rising. Prior to 2022, our region rarely saw congenital syphilis cases, but now we average about 6 a year in our region. So the staff, under the grant, you heard me say DIS, it's a disease intervention specialist. We have a nurse and a social worker who do that work. And what they do is all positive HIV and syphilis labs from the whole region, so all 5 counties, will come across their desk, and they will review the labs to determine if it's a case or not. And from there, they investigate, figure out if the individual is pregnant. If they have syphilis, they find out what stage they're in and make sure that they got treatment that they needed. If they don't have the treatment they needed, they make sure that they talk to their medical provider and make sure they get that treatment. They also try to do partner services where they talk and see who they might have gotten it from and who they could give it to. And then, as well as that, they also do some outreach. And they will use phone calls, letters, and they will also drive to people's houses to make sure that they get these people treated. If they find out someone is pregnant, they follow that person through the whole pregnancy to make sure that they're treated up until they give birth. And then the grant coordinator, that's my job. I manage the subcontractors around the region. We do have 5 subcontractors we work with, and I make sure that they have supplies. They do outreach and testing, so I make sure they have test kits and condoms and everything for outreach they need. I'm involved with the planning and facilitating outreach to community partners. So if we have a lot of people ask for things, I'm always willing to give what we have, and I work with ODH to get the supplies. And I run a congenital syphilis review board, which is as needed. So when we have a congenital syphilis case, we take it very seriously. So after it's complete, we do a review with medical professionals and our DIS to make sure that there was nothing missed in the case, to make sure that every step that could have been. And if there was something missing, then we go back and we make sure that that gap is closed. I also facilitate the Northeast Ohio Regional Advisory Group for HIV, and this is a space for community partners to discuss methods to prevent HIV and plan outreach events. And then I write the grant and do the report, of course. As far as our subcontractors, so these are the people who do a lot of the work. We work with the health departments and different community partners, including Warren City Health Department, Comprehensive Care Center in Youngstown, Canopy in Akron, and Equitas. And then starting in June, we will be working with Portage County Health Department as well. The amount, they take up $205,000 of the HIV grant. So that's like 2/3 of the money right there is going to the subcontractors for them to go do outreach and testing. They set up testing. They have their, they have locations they work with, and they do either weekly or monthly testing. And we try to set those up in high-risk areas to make sure that the people who wouldn't have the chance to get tested. Our contractors have ties within the local communities where they have access to the priority population that we might not have. So it's really great to have them to reach people that we possibly couldn't necessarily reach. They do a lot of times at night and weekends and a lot of work like that. They go to bars and all different places to test. And then in 2025, our subcontractors attended or planned 498 testing and outreach events. They did a lot of work. As far as the testers, so for HIV testing, this was 2025 as well, 747 individuals tested. You can see the numbers. So we have CTR testers here. A CTR is a counseling, testing, and referral tester. So they have training to make sure that they're counseling and they're referring them if the person wants to be on PrEP, or if they just need any kind of other services, social services or anything. They're trained to help them with that. All the testing is free to the public, and ODH supplies the test kits when needed. We do risk assessments to make sure that people are high risk enough to use the test, but we are moving Summit County Public Health Clinic into an opt-out test. We're doing that right now, where it's going to be where everyone who comes into our clinic will get tested unless they specifically don't. Another part of the grant is the vending machines that you guys all know about, I'm sure. There are 10 vending machines throughout our region. I control 4 of them under our grant. So 4 of them are HIV grant funded, and the other 6 are from harm reduction. So I work closely with harm reduction to make sure all the machines have both the supplies. So we work together. I give them all the supplies they need. They give me the supplies I need. And then we also provide stock for Portage County Health Department that has some vending machines, and then they stock it themselves. The vending machines that I'm in charge of are the 2 at this location. We have one at the Summit County WIC location on Arlington Road, which is nearby. And then we also have one at Warren City Health Department, which is far away, so we do have our contractor that supplies that one. We give them the supplies and they stock it. And then from all items are free. We ask people to just take what they are going to use. And then from all of 2025, we did have 2,171 safe sex supply kits distributed, and they all include testing information. As far as marketing for the grant, we did in 2025, we did exterior and interior bus ads. Between the 2 grants, we had 225 interiors. The interior bus ads had QR codes, so if someone sitting on the bus could use their phone to go straight to the website and request free things or get information about testing. And then we also had 80 exteriors, so people, as the bus was driving by, could see it. I post monthly on Facebook and X, with no cost. And in 2025, we had a total of 12,373 views or impressions and 71 reactions and engagements. And we are starting now to do paid advertisements. We're doing more engagement. So that's what we're doing in 2026. And then we also do sponsorship for local events, Pride, KSC Rainbow Run. As far as outreach, we had community partners reach out to us 63 times in 2025 to get supplies or educational materials. 27 times it was to medical facilities, 36 to local community organizations. And these partners included multiple addiction treatment centers, regional health departments, local nightlife and the Akron Bath House, community support services, the local HIV Dumas Center, Friends and Tents, Akron and Kent locations for the colleges, Summit County Jail, barbershops, Akron Black Nurses Association, and both SUMA and Cleveland Clinic. And then we also attended Akron Pride and the Metro Wellness Health event. And we distributed over 167,000 condoms in 2025. Any questions?
I have a question. Do we see a lot of misuse from the vending machines? I mean, do people go there and just grab things?
Good question. So we don't, surprisingly. I only had one time, because I've been running them since they were out, and I only had one time where it was like, oh my God, someone took like 20 things. But even that, I mean, we still had stock left after our visit. We haven't had any issues with that. It's so surprising. The vending machines are set up so that you can, it's a universal code, because I didn't want to be where they had to set up their own code, and it would be a barrier to getting supplies. So you just go up, you press pound 9999 pound and the number, and most people take 3-4 items. So we really haven't seen that. Even the ones that aren't as closely washed, like the one we have outside, one night. That's the only one that has ever been hit. One night it was overnight. Well, they needed them. Maybe they needed it for a big group.
Party.
Hey.
I have a question. When we saw the numbers initially of people who've been affected, do you have that information by race?
We do. I don't have it here, but yes, we do. Every year we do the reports for the grant. We separate it out by
So
race.
could I get a copy? Could you see that we get a copy? I can certainly do that. Race.
Well, thank you, everyone.
Thank you very much.
Thank you.
All right. The meeting is called to order at 5:13. I have a roll call vote to establish quorum, please.
Dr. Blakesley?
Here.
Chief Chapin?
Here.
Dr. Cook? Here. Dr. DePompe?
Here.
Mr. Gannell?
Here.
Here.
Ms. Hayes? Lowry?
I'm on the phone.
Thank you, sir. Mr. McGuire?
Aye.
Dr. Mimonis?
Here.
Mr. Senderak?
Here.
Mr. Snell?
Here.
Somerville?
Here.
Dr. Varian?
Here.
Ms. Williams? Here. Thank you.
Thank you. All right. May I have a motion to conduct business by voice vote unless a roll call vote is specifically required by the Board of Health bylaws, state law, or is requested by a member of the board?
Second.
All those in favor, all those in favor?
Aye.
Any abstentions? Any opposed?
We'll have to do a roll call.
Roll call?
Dr. Blakesley?
Yes.
Chief Chapin?
Yes.
Mr. Cook?
Yes.
Dr. DePompe?
Yes.
Mr. Gannell?
Yes.
Simsberger?
Yes.
Ms. Hayes? Mr. Lowry is not able to vote. Mr. McGuire?
Yes.
Dr. Mimonis?
Yes.
Senderak?
Yes.
Mr. Snell?
Yes.
Somerville?
Yes.
Dr. Varian?
Yes.
And Ms. Williams?
Yes.
Thank you.
Thank you. All right. Approval of the minutes of the regular board meeting. May I have a motion to approve the Board of Health meeting minutes from March 12th, 2006?
So moved.
Do I have a second?
Second.
Any opposed? Any abstentions?
all in favor.
Oh, all in favor, sorry.
Aye.
Any opposed? Any abstentions? Okay, motion carries. Minutes are approved. All right, I do not believe we have any public or staff comments. Any staff have any comments? No public comments? All right, next is reading of the late filings. We don't have any today. Next, I would like a motion to adopt resolution number 014-26 entitled Approval of the Consent Agenda Schedules and All Matters on the Consent Agenda. Second. Any discussion? All those in favor?
Aye.
Any opposed? Any abstentions? Motion carries. Next is committee reports. Community Health and Wellness, no report. Financial Operations, no report. Governance Committee, no report. Human Resources, we will be talking about the Health Commissioner evaluation in executive session. Any other reports?
Yes, I would like to make
Okay.
this kind of meeting. As probably you all know, we developed new bylaws several years ago. And at that time, while we were developing the new bylaws, we chose not to evaluate Donna Skoda in her last year. We also did not evaluate Christopher Barker in his first 6 months. So this actually is the first time that we are using the new bylaws and the new procedures to evaluate the medical director and the commissioner. And we're learning by doing. But I would like to take this public time to thank 2 staff members who have helped us through this process to this point. And so I would like to thank Eric Flint, who is from IT and who helped to take the rubric that we developed as a committee and put it into the SurveyMonkey that you all received. And we did learn that we need to identify to all of you who the evaluation is coming from, because some of you did not recognize the survey when it came out. So we did learn something, that if Eric is doing the survey next year, his name will be on there, and we'll make sure you all know it's coming from him. But also like to thank Angela Woods. Angela has sat in our meetings for many years and is the one constant. As our committee changes, Angela doesn't change. And so she has a history of the HR committee and the HR committee decisions, and she can be counted on to know the procedures as the committees change. And so I just wanted to publicly thank both Erica and Angela for their hard work on the survey and the results that we have obtained. So thank you.
Thank you. That was very nice. All right, Health Commissioners report.
Strategic planning, no.
Oh, strategic planning, no report.
Okay.
Health Commissioners report.
All right, thank you. Good evening. Following this meeting, the Community Health and Wellness Committee will be meeting here in the boardroom. On May 14th, the Financial Operations Committee will be meeting after the board here in the boardroom. The first quarter non-board contract report, strategic plan report, and full-time equivalency report is included in your packet. In regards to program and fiscal updates, in the board report, it provided updates relevant to current legislation being considered by the Ohio Health Committee. There is a summary that's provided in your report. Please consult the document for more information. Tanya Burford in the committee will be discussing House Bill 690 relevant to solid waste. That will be in the Community Health and Wellness Committee. Summit County Public Health conducted its first virtual board meeting in March. That is available for viewing on YouTube. There is information in the Board of Health packet specific to the policies relevant to participating virtually as a Board of Health member, as well as some important notes identified from our last board meeting. So please have a chance to take a look at that and review that content. Summit County Public Health is also refining a new tool to support the visualization of private water systems and sewage treatment systems within Summit County. This tool will identify the locations of the types of systems in a pop-up window when you hover over it. Right now, due to integration challenges and some of the complexity in great. We cannot at this time link specific reports or data to the geocoded locations on the map. I think Eddie's going to bring this up just for viewing. I know I provided a snapshot in the Health Commissioner's report. This may be an option in the future if we had the ability to build this out, but due to time and the complexity of this, we're not going to be addressing this at this point in time. The main intent of this project is really to support visualizing the system and support public awareness relevant to our private water systems and septic systems within Summit County. So there's a demonstration on the map. So you can kind of see the target locations in some jurisdictions where we have a plethora of private water systems and septic systems. Eddie, could you hover over one to show the pop-up? All right. There's an example. You can see the parcel ID, the address, the type of system, if it's known or unknown. We're still updating records, refining this to make sure that we have all the documentation recorded. As you can see there, it indicates the type of septic systems that's available. And because we can't link records at this point in time, you can either click the view that is in the pop-up, or at the very top, you can see, click here to search our water quality records. That takes you to our Summit County Public Health water quality webpage, where you can search the specific records there by address name. So it's a unique tool. I just wanted to provide a summary for the board. Okay.
Yeah, that's nice.
Also, we updated our website recently to comply with web accessibility guidelines to ensure ADA compliance on our public health web and mobile applications. A widget is now enabled at the top left of our website. Eddie also is pointing it out right there. In addition, our contract with Level Access, that's who our provider is, includes ongoing website and end-to-end user testing by a disability expert on all of our digital assets to identify compliance issues and to ensure continued compliance. This is one of the requirements that we had to meet. We actually just had a training today relevant to this widget and its application on our website. So if you have a chance, please play around with that. This is a requirement for all government organizations. And also, you may have noticed when you drove into our facility today, we installed digital speed signs next to our Building B entrance. The intentions of these signs are really to slow excessive speeding that's occurring in our parking lot. We wanted to place those specifically around the WIC location where we have children and infants coming in. It is a common complaint that we receive, and it's a clear safety issue that we want to try to mitigate. So we procured those items and have installed. We also included some signage within our lot. When we host large events externally, our parking lot is very full, and we want to make sure that our clients who are coming in for vital records or WIC or dental services can quickly come in and receive their services. Have a close parking spot available instead of walking the full length of the parking lot. With that, that concludes my report unless there's any questions.
All right, thank you. Fiscal report.
Thank you. So just a final reminder that the Health Department's Budget Commission meeting will be held next Thursday morning at 10 a.m. In the old Board of Elections building on Grant Street. There was a email sent out from Dawn with a Team Meets, I believe, link for any board members who'd like to attend virtually. Chris and I will be in attendance to present the budget to the commission, and anyone else is welcome to attend in person as well. Also, the monthly reports are in your packet, and if you have any questions, I can definitely take those.
Any questions on the monthly report? All right, thank you. Environmental health.
Very impressive.
Yep.
Hello, Dan. This will be my report.
Much easier.
This is not covered green.
Thank you. So tonight, I am presenting variance request for, 3814 Talent Drive, in the city of Greene. So this is more along the lines of what we're used to seeing as opposed to last month. This is, an existing home with a failing system, and they have proposed to replace with an MPDS discharging system. So this is a contained system. We've been working with this homeowner since last summer. There were a number of obstacles, including the fact that originally their parcel ended about here. So they, and Ohio Department of Natural Resources owned the rest. So we have had that in previous cases, and typically ODNR will grant them an easement to use that location because the proposal for their system was basically outside of their property. This is a deck here, and this is all kind of graded down. It's difficult to see in this picture. This is all concrete, except for a tiny little patch of grass. So there truly is no other location to site the system. So they worked with ODNR. They ended up purchasing that portion, and they now own it. And the system will be 4 feet 10 inches from their patio and 8 instead of 10. All of these are a 10-foot requirement, 8 foot 8 inches from the deck on the house side, 5 feet from the deck on the lake side, and then 5 feet from the western retaining wall, and 3 foot 2 feet from the southern wall. The system is actually going to be installed inside kind of like a concrete container, just to ensure that it doesn't float. So it'll be backfilled, and we have documentation from manufacturers that doesn't affect the functionality of the system. And we do feel like this is the only option for them to remain in their home. I would recommend approval.
That's all water right there.
That's correct. This is their dock. So, and the lake. Very tight.
Are they?
Anybody have any other questions? All right. Thank you. I'm going to read the motion, so I can read the whole thing, if that's okay?
Sure.
Great. I'm going to ask for a motion to adopt resolution number 015-26, approving and granting the issuance of a variance for Elwood C. Terrell Jr. at 3814 Talent Drive, Greene, partial ID 28-05475, Summit County, Ohio 44319, for the installation of a new sewage treatment system.
So moved.
I have a second.
Second.
Any discussion? All those in favor?
Aye.
Opposed? Any abstentions? All right, motion passes. Thank you. All right, clinical health and medical director's report.
Good evening. I start by requesting a motion to amend the clinical health fee schedule.
All right,
So, we should read it.
I have to read the whole thing. Hold on one second, I'm sorry. Could I have a motion to amend resolution number 004-26, entitled Resolution Replacing the Clinical Health Fee Schedule of the Summit County Combined General Health District, repealing resolutions inconsistent therewith and declaring it an emergency effective April 13th, 2026. Second? All those in favor?
Aye.
Any opposed? Any abstentions? Okay, motion passes.
Thank you. And then I just have a few quick updates that I want to highlight. As of April 3rd, there's been close to 1,700 legal cases within the United States. That constitutes about 3/4 of the total cases that occurred in 2025, just here in the first quarter of 2026. Past 2 weeks, Utah has really been where most of the outbreaks are occurring, but we're continuing seeing about 100 cases, just shy of 100 cases in the United States. Also, many of you may have heard of the new COVID variant, the cicada variant. So it constituted about 4% of the cases, and it just consisted along through the years like that, and then it burst up to 20% of the cases just over the last month. It's in 25 of the states within the United States, and mostly in the northeastern portion of the United States, including Ohio. No evidence of any more severe illness associated with it. There's been 70 to 75 mutations in the site, so it does seem to evade any of the vaccines. Note of that. Also, I wanted to bring to light, there was a CDC HON alert that was put out on April 2nd about increased reports of metatomidine found in illicit drug supplies. So metatomidine, on the streets, they call it Dex or Rhinotrank. It's actually an animal tranquilizer used for sedation. It's not approved in humans. It's a long-acting, also to adrenergic agonist, very similar to clonidine. What we're seeing is very severe effects with overdoses and withdrawal. So an overdose is severe sedation, severe bradycardia down in 30s, and hypertension. Withdrawal, however, though, also occurs. There's been reports, people sitting in the waiting room seeming just fine, and then all of a sudden having profound tachycardia, hypertension, anxiety, nausea, vomiting, and really just needing rushed to the ICU. So there's been work going out to all the emergency rooms, be aware of this. We've seen a lot of outbreaks, clusters of metatomidine affecting drug supplies, particularly in Philadelphia and Pittsburgh. So we have paid close attention in wastewater in our area to see if we're seeing anything. We are seeing anecdotally people testing with the test strips, saying things have tested positive. There are some false negatives that can occur, but the fact that they've reported to us that they're seeing that. And also been having conversations with the emergency room. It really takes a turn-on treatment when you see I also have the communicable disease report and influenza surveillance report, posting the reports, and I can take any questions.
Any questions? Thank you. All right, I would like to have a motion to adjourn into executive session at, I'm sorry? I don't have to talk about it. Okay. Motion?
You have to read.
Oh, that's right. To consider, we have 2 items to discuss in executive session tonight. The first is to consider the appointment, employment, dismissal, discipline, promotion, demotion, or compensation of a public employee or official, or the investigation of charges or complaints against a public employee pursuant to ORC 121-22, and second, to consider the purchase of property, both real and personal, tangible or intangible, or to consider the sale of property, either real or personal, by competitive bid if disclosure of the information would give a competitive advantage to the other side by division, G2 of section 12122 of the revised code. All those in favor?
We need a roll call.
Oh, I do have to do a roll call. That's okay, thank you. I need your help right now. Could I have a roll call, please?
Dr. Blakesley?
Yes.
Chief Chafin?
Yes.
Dr. Cook?
Yes.
Dr. DePompe?
Yes.
Mr. Ganell?
Yes.
Yes.
Mr. McGuire?
Yes.
Dr. Mimonis?
Yes.
Sundarek?
Yes.
Mr. Stone? Mr. Somerville?
Yes.
Dr. Varian?
Yes.
Ms. Williams?
Thank you.
Corey, Don, and Eddie, and Joe can stay for this first session. We'll hold for a second as
I'm not coming. Other people are gonna wonder what you're talking about.
Executive session to talk about cupcakes?
Yeah. Out of it. See that right at the end of the table. You're like Trump, pictures. Appreciate it. Well, we always see him at the end. Okay.
You go.
Okay, all right. May I have a motion to reconvene from executive session?
I make a motion to reconvene after executive session with no decision.
Second.
May I have a roll call? I guess I will do the roll call. Dr. Blakesley?
Yes.
Chafin?
Yes.
Dr. Cook?
Yes.
Dr. DePompe?
Yes.
Mr. Gano?
Yes.
Myself, yes. Mr. Lowry? Mr. McGuire?
Yes.
Dr. Mamona? Yes. Mr. Sedrak?
Yes.
Mr. Snell?
Yes.
Mr. Somerville is here. Dr. Varian?
Yes.
And Ms. Lyons? Okay, great. All right. Okay. I don't think so. Okay, we do have some motions out of executive session. The first is, can I have a motion to enter into a purchase agreement with Akron Regional Hospital LLC not to exceed $52,800 contingent on inspections and contingencies outlined in the letter of intent?
So moved.
I have a second. Any discussion? All those in favor?
Aye.
Any opposed? Any abstentions?
I understand.
Okay. All right, second motion. Do I have a motion to increase the health commissioner's salary by 3% to be consistent with all other employees in the health department?
Okay.
Any discussion? Okay. All in favor?
Aye.
Any opposed? Any abstentions? Okay, motion carries. All right.
Any other business?
Any other business? Okay, we have a motion to adjourn the meeting. Oh,
The meeting is adjourned at
motion to adjourn. Meeting is adjourned at 6:15.
Oh, that's rules,
This
sorry.
is wrong.
I'll update that.
Great job. Good job.